Hello, Mrs. Snow?
Yes.
Hi, my name is Luann Lonergan, and I'll be a registered nurse. Can you tell me your name?
Winter Snow.
Okay, I'm going to just check your armband. Great. And Lori, if you want to help me, I'm going to just get the bed up a little bit. Mrs. Snow, I understand that you've been having a little trouble with urination.
Yes, I have.
Okay, the physician ordered me to insert a catheter into your bladder. Okay, and I can feel
that hurts.
Okay, so I'm gonna just do a little bit of care down there. I'm gonna do some peri-care, and I'll clean that up, and then I'll get my supplies. Okay?
Is this okay, Luann? This height is okay for you?
That's a beautiful height. I'm just going to put down the side rail there. Mrs. Snow, do you have any allergies that you know of?
I'm not allergic to anything.
Okay, good. What I'm going to do, I'm just going to put on a blanket. Lori will help me. We're going to kind of do that so you don't get cold during the procedure. Okay? All right. And we'll just take that blanket down, Lori. Beautiful. Okay. All right, Mrs. Snow, what we're going to do is we're going to put your head flat. So Lori, I'll let you, so we're going to have a relatively supine. And I really like those knees externally rotated, or the knees flexed and the legs externally rotated. So that's good. We'll kind of get this tucked away here. All right, and Lori's by the bed, so that's good. All right, so I'm going to come on over here, and I've got a garbage bag I'm going to cuff up here, and that'll be for my dirty linen. There we go. Mrs. Snow, I'm going to just check if you want to check the water temperature. How is that?
That feels good.
All right, good, good. I'm going to put on some gloves. All right. And I like to do that peri-care before, just to kind of clean up that area before we sterilely put in that catheter. So I'm going to just put a little soap on here. Okay. Okay, it's going to be a little cool here, Mrs. Snow. I'm going to go down the middle, clean to dirty. I'm going to use a different part of the washcloth and a different part of the washcloth. And then I'm going to just put that in the garbage. Okay, good. Now I'm going to rinse that area. Again, I like to make a little mitt. Okay, I'm going to go right down the middle, use a different part of the washcloth and a different part of the washcloth. Are you doing okay, Mrs. Snow?
Yeah, I'm doing just fine.
Alrighty. And then I'm going to take a towel in the same procedure. I'm going to go right down the middle, use a different part of the towel and a different part of the towel. Okay, great. All right, and I'll kind of keep that off to the side, and I'll clean that up later. Good. Now what I'm going to do is I'm going to take off my gloves and wash my hands. And I'm going to put away some of these, some of the water here, and I'll take care of that later. Great. What I'm going to do, I like to wash off the table that I'm going to use. There we go. I'm going to wash off the table, and I'll let that dry. Very good. And then I'm going to wash my hands again. Then I'm going to get some supplies ready. And I'm right-handed, so I'm really working on the right side of Mrs. Snow's bed. If I was left-handed, I would go on the other side. Okay, the first thing I do is I have a Foley drainage bag, a urinary drainage bag, and it's got a sterile cap on there. So sometimes you have kits that the Foley catheter is all attached, but this one is separate, so we have to add that to the bed. So that I'll leave for later. Then I'm going to come on over here. I've got a couple of supplies. All right, and the first thing that I'm going to do, I've got the bedside table about waist height, and I'm going to take a peek at my supplies. And I have a 14 French catheter, expiration date of 6 of 16, so this should be good. And what I'm going to do, again, I've checked allergies here for Mrs. Snow, and she has no allergies. I'm going to tear a piece of tape because I'm going to have to tape that catheter off to the side for the procedure. So I'm going to be very careful now. I'm going to peel. I look at it, it says peel to open, and I'm going to peel open and keep that inner part very sterile. So I'm not going to touch anything on the inside. There we go. And I'm going to tape that to the side of that bedside table. And I want to make sure that that tape sticks. There we go. Good. Great. And I'm going to be careful not to reach over that. Now I've got my cath tray here, and it's going to have my contents in here. And it looks like it's sterile. So I'm going to open this up. There's a peel here, so I'm going to peel that area off, and I'm going to open that up. I'm going to take out that bin. And actually in here it says used by 3 of 15, so that's the expiration date, so that's real good. Now I'm going to turn, because I really want to reach over, so this actually looks pretty good. I'm going to want to open it. The first flap is going to be away from me, so I'm going to open it up across the table, and then I'm going to pick up this side with my right hand and the other one with my left hand. Beautiful. There's a drape there, and then I'm going to open this last one down here. All right, now I'm just going to just uncover Mrs. Snow. And Mrs. Snow, I'm just going to grab a drape here. I'm going to pull back, I'm going to step back, and I'm going to have the shiny side towards me. And I'm going to and this is really just a nice drape that we can use to kind of capture, just to make sure it doesn't spill at all. All right, and I'm going to just lay this down. Doing okay, Mrs. Snow?
I'm doing just fine.
Okay, good. Now what I need to do, I've got some sterile gloves, so I'm going to just grab those out of there, and I'm going to put those on off to the side. So I'm going to open those up off to the side. I can reach everywhere I'm touching is fine. And it says left on the left side, right on the right side. So I'm going to open those up. And the first one, I'm going to grab the cuff, and I like to step back a little bit, and I can put that right on. Great. Now for the second one, I go underneath that cuff, and sometimes I have to hold that paper so it doesn't move. And I can abduct my thumb away, and I can put that on. Real good. All right. Now what I'd like to do, I'm just being careful not to go over the catheter that's opened, and I'm going to take this drape, and I usually just set that off to the side. I've got some sticks that I'm going to have to open, and so I'm going to look at those swab sticks. The expiration is good, so I'm going to open up those swab sticks, and I'm careful then just to drop that off to the end, and I'll pick those up a little bit so they're a little bit easier to deal with. And I can set those off to the side. That's perfectly fine. I'll grab this sterile specimen container. I'm going to put it off to the side, and I'm going to put on the cover loosely because I'm going to need that later on. There is a little label in here, and I'll just put that off to the side. And also then there's some lubrication, and I'm going to open that up and squirt that in. So that's really what I'm going to do into the corner. There you go. Good. And I can set that off to the side. Now I'm ready to grab that sterile catheter. So I can grab that here, and I'm going to coil that in. I kind of like to roll it up a little bit into my hand, and then I like to transfer it to my other hand. Good. And I'm going to then take the syringe filled with sterile water and attach that. Good. Now I'm going to uncoil that a little bit, kind of let that set down a little bit. And then I'm going to get that end about 2 inches lubricated with that lubricating jelly. All right. turn that around. I like that off to the top. There we go. Good. So that looks real fine. Some kits don't have that inner sterile drape, so we would have to manipulate this bin sterilely without touching the outside. So I'm going to show you a nice trick that I like to do. So it doesn't matter if you have a drape or not, we're going to keep that sterile. So what I'm going to do is I'm going to put my hands inside the container, and I'm going to come off to the side like so. There we go. Good. And now I've kept everything very sterile. So now what I need to do, I'm going to just contaminate my left hand, and that's okay. I'm going to take my swab sticks, I'm going to go across on the far side, clean to dirty, and drop it. Then I'm going to go to the near side, clean to dirty, and drop it. Then I'm going to go right down the middle, clean to dirty, and drop it. Very good. Now I'm going to take that catheter and I'm going to take it about 2 to 3 inches down. Mrs. Snow, we're almost ready, and I'm going to insert it. I'm going to have her take a deep breath. As she exhales, I will insert the catheter. And we're going to go on in. Good job, good job. Oh, I see urine, and I'm going to go another 2 inches. And if I can't get it in there, I'm going to rotate that a little bit. Good job. Now I'm going to let go here and hold on to that catheter as I inflate that balloon. How do you feel, Mrs. Snow?
Good.
All right. Everything's going in real good. Now I'm going to give it a little tug. It's all in there. So I'm going to be careful now. At the tip, I have to make sure not to touch that tip. And here's the urine is flowing. And now I can come on over here, and I'm going to put that cap upside down, and I'm going to get about 20 to 30 cc's of urine. And we'll deal with that later. Good. So most facilities, you can empty the entire bladder, but some facilities have a policy that after 1,000 cc's, you would clamp it. So you would want to follow your facility policy. Very good. So we're draining. How are you feeling, Mrs. Snow?
Much better.
Great. So one of the things that I need to do now is I need to attach this end. So this end is sterile and that end is sterile. So what I'm going to do is I'm going to pop that off, and I'm going to be very careful to get that over the lip. Beautiful. And we're going to get that up. All right, good. Now what I like to do is I like to just move this urine over here and get it out of the way. I sometimes like to take this, there's a little lubrication sometimes, so I wipe that off. Good. All right. I'm going to take off my gloves and wash my hands, and I'm going to put that bag down a little bit. I'm going to get that stat lock back on. So I want to make sure that there's no dependent loops at all, so that's all going straight down. Very good. I'm going to put on some clean, fresh gloves, and I'm going to just need to attach that catheter so we're not pulling at all. How are you doing, Mrs. Snow?
I feel a lot better.
Oh,
There's a
good.
lot less pressure.
Very good. So the stat lock, there's many different types of tube holders, but that's one that many facilities use. And so, oh, that glove kind of broke a little bit. I'll have to get a new one. I like to put a little bit of skin prep on that area just to make sure that it's going to stay there, so it protects the skin underneath there. So I'll get a couple of my supplies here. Good. So I'm going to put this stat lock in here. Let's see. There we go. There we go. And I'm going to just kind of give it a guesstimation. I think that gives her enough leeway there. So I'm going to set that back down, and I'll just pull off some of that skin prep. And we'll let that area dry a little bit. And then we'll be able to peel off that backing of our stat lock, and we'll put that right on our patient, and then she'll be able to move around without that pulling or tugging on her. So that seems like that's pretty set. All right, good. Does that feel okay? Mrs.
feels
Snow?
fine. Feels
All
fine.
right, real good. So we'll get Mrs. Snow kind of comfortable. I'll take out the linen. I'm going to put the bed down, give her the call light within reach. I'm going to take care of the urine. I'll empty that. I want to measure. I want to look at the coca, the color, the odor, the consistency, the amount of the urine. And it looks like it's draining very well into that tubing. And then I'll take care of my urine sample. I'll put on that label, and I'll make sure to put that in a biohazard bag and get that off to the lab. So I think things look real good. Mrs. Snow, any questions?
No.
Alrighty, thank you.